if you ask a man in his 30s, maybe somebody like me, to go and get his blood pressure measured every year, probably not going to rush to do that. What's the point? I'm not interested in that. But if maybe a man like me has ED symptoms, they're going to see you straight away. They're going to run to you. Is there maybe something that we could put out and suggest to people who in their heads too young to have any problems to
Yes.
actually go for those tests and maybe think of sexual health as an early warning sign or an early marker of why does
Yes. Jack, this is such an important point. I'm glad you're bringing this up because the reality is that erectile dysfunction is not a disease. It's a symptom of something bad going on. You call it a check engine light, meaning that either you're suffering diabetes, depression, cardiovascular risk. There are numerous studies demonstrating that if a man has erectile dysfunction, he's much more likely to have a cardiovascular event. In fact, 15% of men will have a cardiovascular event within 7 years. It's quite high. If a man has erectile dysfunction, he's much more likely to have occult diabetes, 30% chance he has underlying diabetes. And we also know that men who have ED are much more likely to suffer from depression and anxiety. So the biggest mistake you can do, I tell my colleagues, is when the man walks in with erectile dysfunction to just hand him the Viagra and say goodbye. Because all you're doing is allowing that disease process, whether it be diabetes, cardiovascular disease, whatever it may be, to get worse from year after year after year, so that when you finally find it, whether it's a heart attack or uncontrolled diabetes, that patient has taken that hit for so long. So I say to them, that's the time to capture them. And you're correct, Jackie. I remember when I was 30, there was no way I was going to go in for an annual hypertension screen or annual blood pressure or a sugar screen. I was invincible. But if a young man gets ED, he is at my front door tomorrow morning, ready to be seen because he's like, what's going on? So I tell my colleagues as well, ED is the gateway to men's health. He may not come in for hypertension and he may not come in for his sugar screen, but he will come in for ED and you stop and you screen him and take care of him and counsel him then because he's right there. So it's like a golden opportunity. So I do say that ED is a gateway to men's health and to screening men for men's health. But ED, again, very important. If you're suffering from erectile dysfunction, it is a symptom of something else going on.